Hawthorn is often called the heart herb for its various cardioprotective abilities. It's prized for its ability to uplift and to strengthen the heart, both emotionally and physically. The hawthorn berry has been used for centuries as a natural remedy for all kinds of serious heart conditions. These include angina, high blood pressure, hardening of the arteries, irregular heartbeat, and even congestive heart failure. In fact, hawthorn has been used to treat heart disease all the way back to the 1st century. Fast forward to the early 1800s, and doctors in the US were using this medicinal herb for respiratory and circulatory heart disorders also. Hawthorn fruit leaves and flowers are used medicinally today. The hawthorn fruit comes in the form of little red berries. Native American tribes enjoyed eating them, and they also used the hawthorn to treat heart troubles as well as gastrointestinal complaints. It appears that there's numerous flavonoids in the hawthorn berry. Flavonoids are potent antioxidants known to effectively decrease inflammation while also boosting immune function. Eating a diet high in flavonoid-rich foods, beverages, and herbs has been linked to the prevention of cardiovascular and neurodegenerative diseases as well as cancer. The hawthorn herb is loaded with healthy, beneficial compounds. These compounds have been shown to really boost the heart health. The hawthorn's antioxidant flavonoids improve blood flow, and they guard against blood vessel damage, and they even help to dilate blood vessels. These flavonoids include OPCs. These are oligomeric proanthocyanidins. The OPCs are some of the most prevalent polyphenolic substances found in the hawthorn. There's also many other chemicals found in the hawthorn, such as flavonoids like hypericide, quercetin, vitexin, rutin, choline, acetylcholine, chlorogenic acid, caffeic acid, vitamin B1, B2, vitamin C, calcium, iron, and phosphorus. The hawthorn berry is best known for its helpful toning effects on the heart as a cardiotonic herb. Hawthorn has shown itself to be immensely helpful for all kinds of serious heart concerns. These include heart failure, heart disease, angina pectoris, change in cardiac rhythm, and atherosclerosis. According to a 2016 study published in the journal Current Medicinal Chemistry, hawthorn's powerful heart benefit comes from its high polyphenic content. To date, research has shown that the hawthorn can even have a helpful effect on congestive heart failure. Multiple studies have shown that the hawthorn supplementation has resulted in improvement in cardiac function based on a number of parameters. These parameters include blood pressure, heart rate, cardiac output, and exercise tolerance. One trial in particular gave 78 patients with class 2 heart failure a commercial preparation of hawthorn leaves and flowers. After 2 months, the patients who were receiving 200 milligrams of hawthorn 3 times per day had an increased working heart capacity as well as a reduction in symptoms. The hawthorn group also showed a decrease in systolic blood pressure during the physical activity. Another German study also showed that the hawthorn extract worked nearly as well as a prescription heart failure drug, and the hawthorn extract had fewer side effects. Another cohort study of 952 patients with heart failure had subjects take a hawthorn extract either alone or as an add-on to conventional treatment. After 2 years, fatigue, stress, and palpitations, the 3 main symptoms of heart failure, were all significantly decreased in the group who took the hawthorn when compared to the group who did not. Many herbal practitioners recommend hawthorn berries, flowers, and leaves as a natural blood pressure reducer. A scientific study published in the British Journal of General Practice had 79 type 2 diabetic patients either take 1200 milligrams of hawthorn extract daily or placebo for a total of 16 weeks. Hypertensive drugs were also taken by 71% of the study participants. The hawthorn group experienced greater reductions in diastolic blood pressure, but there was no group difference in the systolic blood pressure. The diastolic reading, or the bottom reading, is the pressure in the arteries when the heart rests between the beats. This is the time when the heart fills with blood and gets oxygen. Over the years, research has found that both numbers are equally important in monitoring heart health. However, most studies show a greater risk of stroke and heart disease related to higher systolic pressure when compared to elevated diastolic pressure. According to a scientific article published in the Journal of Herbal Medicine and Toxicology, Hawthorn's bioflavonoids help to dilate both peripheral and coronary blood vessels. This can improve the blood flow to the heart, making hawthorn very useful for angina. Hawthorn's pro-anthocyanidins are also believed to reduce the tension of the blood vessel walls. Again, this is very helpful to discourage angina. In one study of 80 subjects with stable angina pectoris, who were randomly divided into 4 groups. The first group was the aerobic exercise group. The second group took a hawthorn extract, and the third group did aerobic exercise plus they took a hawthorn extract. Finally, the fourth group was the control group. After 12 weeks, the researchers found that the combination of aerobic exercise and hawthorn supplements were an effective complementary strategy to significantly lower the risk of atherosclerosis and heart problems. Animal studies have shown that hawthorn berry can be helpful as a natural remedy for the reduction of LDL or bad cholesterol. In China, hawthorn is called shanza. A study using animal subjects showed some really impressive health results from an ethanol extract of the hawthorn. The 2016 study revealed that the hawthorn berry extract not only reduced the overall high cholesterol level, it also notably decreased the LDL cholesterol, the liver cholesterol, and the triglycerides, as well as the body weight. Scientific research conducted in 2008 revealed that hawthorn berry extract is excellent at decreasing inflammation. This is huge for health since we know that inflammation is at the root of most diseases. The research also showed that the extract of the hawthorn berry is a free radical scavenger. This is extremely beneficial to human health since free radicals can cause cellular damage, including DNA damage, by stealing electrons through a process called oxidation. The 2008 animal study also demonstrated how the hawthorn berry extract has protective effects for the gastrointestinal system, and it appears to successfully kill off various types of unwanted bacteria. Some herbalists consider it to be an adaptogen, with its berries being given for physical heart complaints and its leaves and flowers being used for emotional heart-related problems. There's a few options of how to take the hawthorn. You can opt for a hawthorn berry tea, either pre-packaged or loose. Loose hawthorn berries can often be purchased in the bulk section of many health food stores. You can also pick up a hawthorn supplement in the form of a capsule or an extract in a liquid tincture form. So far, safe hawthorn doses appear to be between 160 and 1,800 milligrams per day for a 3 to 24 week period. Noticeable improvement in symptoms will likely take 6 to 12 weeks. For more information about herbs, supplements, or health conditions, check out my website.